uh, but this is still different. And I think it's more mentally taxing. It's hard to, we have to keep track of our calendars all the time to realize what day it is and what we're supposed to be doing. But anyway, some of the working groups I'm on is executive orders and government continuity of what we need to do when we do go back, either codify some of the things that were done by executive order or not, such as notaries. A lot of people, and Ray, in the banking business, I bet you're having notaries done by electronic rather than in person, and that type of thing. And actually, the Secretary of State have been working on this. So I do see that this technology that we've been using is going to be carried through, because the Secretary of State had been working to implement something like this, but hadn't yet done it. But nevertheless, every document or real estate transaction or will that's been done in this COVID time, we have to make sure that the executive order is codified so that it can be relied on later, after it not be challenged in court or something like that. So that's one of the things that we're working on in that working group. And that was just one example. There's very many things that we've got to make sure.
More than one Zoom meeting at a time? Yes.
Then also I'm working on constitutional amendments. And that is, May 3rd was a deadline to get some things that we've been working on, like the Fair Map Amendment. And we had begged and pled our case to get back to Springfield the last week of April so that we could address that. Now, we missed that deadline, but we're also talking about how to maybe get some kind of relief there. Legislatively, we had some political experts and legal experts try to tell us how maybe we could Band-Aid get through and somehow address fair maps and then go back and codify it later by putting it on the ballot and changing it in the Constitution. Now, that would be a very heavy lift, but those are some of the things that we've been working on in that group. Ethics is another one, because aside from COVID, the main discussion at the Capitol prior to all of the epidemic or the pandemic was that a House member and a Senate member had been indicted, pled guilty, and then we have a senator that's been indicted that is currently serving in the Senate. So some of the things we were working, and we've had a whole host of other ethical problems. And so what we've been doing is going through. There was a lot of legislation filed to address some of the problems that they see in ethics. And we've been going over and prioritizing them, and a lot of discussions there. And it's been a very productive working group because so much of that had already been started. But that's kind of non-COVID related, but yet it's a priority of the legislature when we do go back. And the other working group that's been very interesting that I work on is regulatory. If there's, I hate to say silver lining to any of this, because I cannot, we're working on the economic recovery parts to this to go forward. But if there's anything, at least in this regulatory group, we've had so many members hear from their business community like never before. Within the city of Chicago, the bars, the restaurants, every deemed non-essential business that are calling their legislators, perhaps for the first time, because as we know, the economy in Chicago has a life of its own. And now they're talking about pushing back the minimum wage. We're hearing from the chamber, we're hearing from the retail merchants, we're hearing from the Hotel and Lodge Association, all the various groups pleading that there's very many things that we could do that would help us and the business community get back somewhat to where they need to be, and pull back some of the regulation that we've done in recent years, and that are making it very difficult for them, especially coming out of this kind of situation economically. So I feel like we're having a good discussion about many of the onerous regulations that are facing everybody in the business community. So that is a good thing for, like I say, for once. I mean, we've always had good discussion and access with you all to come to us and tell us your issues, but it's really nice to see these Chicago legislators getting calls that are exactly the calls or the distress we've been hearing from you, but they're getting it too. And so that has been a good part of the process. So that's it, pretty much of what we're doing. We can't wait to get back. I was reading today, Mike Madigan was saying that public health and safety is foremost, and I can see if the Senate president felt the heat to call us in, that Mike Madigan may just dig his heels in and not. I'll let Norine give you more commentary on that. I was on one of these regulatory or one of the working groups, and President Hammond sits on those, some of them with us, and the Press Association was on. And one of the problems we've thought about going into session was we have a constitutional mandate that we have to be open to the public when we're in session. And so I mentioned to the Press Association, who was talking to us about Open Meetings Act for local governments and that kind of thing. I said, give me your thought about the going into session at the Capitol, proper social distancing between the legislators and staff, but not open to the public. And he goes, I watch broadcasts all the time. I think you can be open to the public through this kind of telecommunication. And we're going to study if that's actually accurate, given the language of the Constitution. But I thought that was helpful, that seeing some light that if there's a risk, and trust me, Springfield hospitals have enough hospital capacity to put us all in the hospital over there. And that leads me into this 5-phase plan that the governor put out this week. Very disheartening, because based on his own metrics, I believe our area is already at phase 3 and could reopen very much of what we need to open, and do it safely and have the hospital support in place that we would perhaps need. And we want everybody to be safe, but Americans have always taken responsibility for themselves. We have to do what's right for each individual and go from there. But we already meet the metrics that they were given, that we're under 20% of our population is symptomatic or test positive. And all those metrics, we should be at phase 3. And we're going to keep pushing for that, because the thought that we have no dates when we can go back to business or back to what the new normal is just distressing. And it's, it's a very distressing situation to not have anything other than when there is a vaccine being said that's when we can go to phase 5. And that's very troubling. So I'll leave it at that and let the questions come, because I know there's many.
Thank you. Well, Representative Hammond, would you like to kind of tell a little bit about what's happened on the other chamber?
Sure. Good morning. Good morning, everybody. And thanks for this opportunity. But these are really important. We do a lot of Zoom meetings, a lot of conference calls. It's kind of become, I think, the daily life for probably all of us. And quite frankly, it can be a little frustrating, but it is what we have, and we just have to move on with it. There's been some discussion. Of course, there's been a push by a number of us members of the General Assembly, both in the House and the Senate, that we have some really pressing issues that we cannot put off. And as much as people would like to stick their head in the sand and think that, well, we can deal with that another time, it's not possible. And a lot of that is because we have federal deadlines that we have to meet, and we have to make decisions in a timely manner for those as well, to give the feds time to act on what we're doing. So I've been on the Medicaid work group now for a couple of years, and and we have been dealing with a myriad of issues. Most recently, we went through the second phase of the hospital assessment plan, and we were up against a deadline for that because it had to get to the federal government for them to look at our plan and give it a thumbs up or a thumbs down, and we needed to allow them 90 days to do that. We worked in concert with them, and they fudged a little bit on that time frame. So we did get a plan to them. I think it's been about a month ago now, but who knows, because all days go together anymore. So we've moved past that. We have another meeting this afternoon, and we meet weekly on that. We are now into another area of Medicaid and Medicaid reimbursement and our MCOs, and that just seems to be a constant challenge, and we have to do the very best that we can. Also on, beside the Medicaid work group, also on our healthcare and human services work group. Quite frankly, there needs to be a better reality check there. Yesterday on our conference call and our Zoom meeting, we were presented with a list of 164 bills to consider. And I just had to shake my head and go, really? Who's got time for 164 bills? And, they are not going to happen. They are just not going to happen. We will deal with, in my opinion, because of the very, very shortened time frame, we will deal with bills that are pertinent to the budget, bills that have to be passed because there is federal reimbursement that goes along with them. Many of those would be Medicaid related. We will also deal with bills that there are sunsets that have to be extended. And so I think those are the types of bills that we will actually talk about in earnest. And of course, any bills that are related to COVID-19. And a lot of that will have to do with federal reimbursement as well, and what's acceptable and what's not acceptable. And so those are, I think, from up high, from a 10,000 feet level, I think that those are some of the things that we'll be dealing with. We had a higher ed, I also serve on higher ed, and we had that working group. And the reason that we have gone from committees to working groups is because, as Jill mentioned, according to our Constitution, our committee meetings have to be open to the public. We are not in a position right now where we can do that. And so we have switched to working groups, which we have used over the years many times to discuss with all members of the committee what is important, what we need to work on. We cannot take any votes in our working groups, so that's important to know. But the Secretary of State has put out some guidelines that would allow for members of the General Assembly and limited staff to get back to Springfield. Some of those guidelines, of course, wearing a mask, taking proper precaution, social distancing. When a bill is being presented, the member that is presenting would be on the floor to present the bill, and one member of the other chamber would be on the floor to ask questions of that member. So that's some of the things that are being discussed. If I have a crystal ball, I look for the House probably to go back shortly after Mother's Day. But again, everybody's crystal ball looks a little bit different, and we don't know what the Speaker's crystal ball looks like, that's for certain. I will say that for many of you that have been keeping up with it, when we got the financial report for the state of Illinois the other day from COGFA, they did say that we lost $2.7 billion in the month of April. this year. Why did we lose $2.7 billion? First and foremost, we have put the income tax off until July, so that was expected. Also, as you can imagine, tax receipts are way down for individuals and for corporations. There is no receipts from video gaming. Lottery receipts are way down. So the list goes on, but that was $2.7 billion that we lost in 1 month. And when we were presented with our budget in committee in working group the other day, if we work off of last year's revenues and last year's budget, we have $22 billion in what we refer to as above the line. So those are areas that absolutely have to be paid. They are pensions, they are bonds, they are insurance, there's local government distributed fund. Those are all above the line. So those have to come off the total right away. So and they total about $22 billion. That would normally leave, using last year's figures, about $14 to $16 billion below the line to fund every other area of state government, So when you look at that formula, it looks like, whether you support a fair tax or you don't support a fair tax, it makes very little difference. It's about a $6 billion deficit one look and $7 billion deficit the other look. You add to that the $2.7 billion that we lost in April, and I brought up to the budget director. So if we're looking at 2.7 for April, and we have 2 more months in the fiscal year, we could potentially be adding as much as another $5 billion in deficit to that number. So it's very real, and it's going to take a lot of people working together to figure out how we move this budget forward, not just for we're going to see, God bless you, in this year's budget, but what we're going to see for next year as well.
Yeah, I think you hit on some of the points that I wanted to kind of see if you could bring up, Tom. It was the budget projections.
Sure.
And it does look like they are, I guess my question to you, to both of you was, what are the priorities going to be? And I think Representative Hammond, you kind of laid out a few of them, but from a general, with the rest of the whatever 14 billion, how are we going to prioritize what gets what? From the education side, we heard there's a big, advocacy to try to make sure the schools get their money. We've heard this year the money's going to flow, but it may be late, obviously, with the cash flow the way it is. But next year is going to be the question. I mean, I'm hearing everything from around 15% cuts across the line, and that's even if we pay all the pensions and some of the mandated costs. What is the priority list that you guys from both chambers are working off of to formulate the budget for FY21?
Well, I can tell you, for me, my priorities are certainly education, and that is education at all levels. We worked very hard on the funding formula for K through 12 education, and I don't think this is a time to turn our back on it, particularly with all of the struggles that we're having with online learning and remote learning. It's an incredible challenge for the teachers, for the students, for the families, and for the administration. So I don't think that this is the time to turn our back on that. When it comes to higher education, or at least in this area, we were beginning to see an uptick and some positive news from those that were in higher ed administration. And so I think that this is a time that we need to nurture that. And while there's help for higher education through the CARES Act, those limitations are very, very stringent. And 50% of that money goes directly to the student. Absolutely, no question there. It has to go directly to the student. So many of our universities and community colleges are going to be struggling with their foundation dollars. And, you know, as people aren't working, it's going to become even more real because you're not going to have as many people donating to those foundation dollars as you would have in the past. So I can tell you what is not a priority for me at this point in time, and I mean no disrespect to anyone, but when I have colleagues that are talking about they want to pass Medicaid for all, and that for me is absolutely not a priority. We don't have that kind of dollar excess money at this point in time.
I think Norine stated it exactly as I feel. Certainly, we have to fund what she mentioned, what's above the line, the pensions, the insurance, the bonds, and all that. But then likewise, my priority would be education funding at all levels and no new programs. We're in these working groups, we're hearing new programs. One of the ones that I had to shake my head at yesterday was we had heard from the realtors about the eviction process and the like. And many of us on the call have university towns, and we have seen, as we said, we were making strides to build up enrollment and get our universities back. And we've seen the struggle as in Macomb with WIU and the landlords and the like. One of the proposals that one of my colleagues was that we should do a 6-month on mortgages and rent forbearance. And then we would ask the federal government to cover that. Yeah, I mean, you know, how do you even respond to that? You know, it's just like, you want, and that there would be a sunset on that forbearance. It would be when the unemployment level was where it was before March 20th, the lowest it's ever been in the nation. And we just were shaking our heads that, you know, that was going to be an unattainable level for a very long time. And I mean, you know, so I hope the gentleman, he says he's going to send us his bill, but it didn't seem well received. I will say one more thing I had thought of with this crystal ball of when we will go back to session. It's interesting, you know, if we don't hit that May 31st deadline to get the budget, then we hit a different voting. It's no longer a simple majority. It's a 2/3 majority. And so that may get the president and the speaker to call us in, as Norine said, before, after Mother's Day. But likewise, you know, there's, who knows, if they don't, then we have a different dynamic of what's required to pass something after that deadline. And some of it depends on when the bill becomes start date, but definitely the budget, that will be impacted. The number.
How much of our budget issues are going to be predicated off what happens from the federal side? You know, what word are you hearing? You probably got a better line than most of us from our state senators and, I mean, from our, you know, senators and congressmen about some type of a state bailout, or the next quote CARES Act coming down geared towards states, municipalities, and whatnot. What are you hearing from that side?
Well, certainly we want, you know, all the states are receiving some federal assistance. I don't think it was well thought out when the Senate president sent a letter asking his federal representatives to bail us out on our pension problem. You know, we're all going to need assistance with COVID related items. And we're seeing that roll out. That's why Ray and the other bankers have been so busy. You know, at some point this money is going to have to come from somewhere. And Darren LaHood's going to be in our area tomorrow. and we're going to be talking with him about, some of the payroll protection parameters now that we're still in shelter in, and people that might be getting those loans, they have 8 weeks to meet certain guidelines and paybacks, or figure out that. And so that's still restricted because these businesses that have gotten these loans already closed, their reality is changed now by this shelter in, or this phase plan that the governor's put out. So and please contact us if you have problems with the programs or have questions about all the various programs. The self-employed people, we're told, and the independent contractors, the 1099 workers, all of that is supposed to be starting in the works May 11th on the IDS website. Deloitte has been hired to implement those. Now, our website on IDS has been crashed and hasn't worked well, and I am cautiously awaiting that May 11th deadline is a reality, because these people need to get their assistance. It's unreal that they've been 6 weeks without a paycheck. And so we're hoping that is a reality May 11th. And for those that are under the 1099 group, they need to apply on unemployment website now. For whatever reason, they have to be denied and apply now before they're going to be eligible. And I know a lot of self-employed people have tried to get online and they're denied, but as far as I understand, they can still do that, but it's not a firm requirement for them to be denied before they become eligible.
The other part of going back to the federal government. So originally, when there was money allocated for local, for states and certain areas in certain states, one of the guidelines, or more than a guideline, was that it had to be for areas of over 500,000 in population. Well, there's counties of over 500,000. There's very few counties, and in Illinois, there were only 4 counties that were eligible for that money. So it is my understanding that there is very robust discussions going on about how the federal government could possibly get money to some of the smaller counties throughout the states. I'm cautious on this because that's real money too. I mean, it's not just, that federal money is everybody's money. So that's going to have to come from somewhere, sometime, someday. So for those that look at it like a bailout or a gift or a leg up, be careful what you wish for, because it's real money, folks, that somebody's paying for.
Right. And so far, the local governments are very nervous because they don't fall within that large population. And right now, the best we know, it's going to be our executive officer, our governor, who at this point hasn't stepped foot out of Chicago for 6 weeks that I know of. He's going to be making those decisions. And so he has been reaching out to local governments throughout the state, and that's encouraging. That we keep that pressure up, that he recognizes that all parts of the state need that money that's set aside for local governments.
Lauren, why don't you start reading some of the questions we got?
All right, sounds good. We'll start with the first one here. Now that the parks are reopened, what can be done to get the construction at Argyle Lake completed, as Lavadier Construction is available to finish the project?
I've been banging on this project for months and months and months. And going back to when they closed all the parks, my argument at that time, my point at that time was, what could be a better time? There is no one at the park. Why not have them in there right now? Because, you know, it's all going to be for naught. I'm not even talking about what they did with that project. Lavadier has done the very best that they could with what they were given, but it's absolutely absurd. I mean, that is a perfect example of a project that never should have been stopped. Absolutely never should have been stopped. We don't give up. We keep on a regular basis having discussions with DNR about it and DCEO, but as of yet, nothing. Crickets.
No, it should go, and we'll keep hammering for that. I mean, one of the things we hammered was that parks should be open to the public, especially downstate, for recreation, for fresh air, for families, for educational opportunities that a family might not normally have. I smiled whenever you mentioned Lake Argyle, because the DNR map classifies it as Northwest Illinois. and so
And make it up.
So when you go to look at the parks in our region, you hit West Central Illinois, and that doesn't come up. And you're like, where is Lake Argyle? So, but it dips down. Because I brought it to the attention, and I got on the map itself, and it does dip down and catches Lake Argyle. So for whatever reason, it's moved to Northwest Illinois.
Yeah, and I did tell the governor, thank you for what you've done with the parks, but we really need to do more. In initial discussions with him about the parks and boating and this and that, somebody brought up a John boat, and he said, what's a John boat? So there's a real disconnect there. But of course, two of the boats that he owns that I know of, one is an $800,000 boat, the other one's a $700,000 boat. So why the hell would you know what a John boat is? But my point to him was, two people in a boat, if you are a family of 3 or a family of 4, whatever, what do? Leave 1 or 2 of them on the shore? It makes absolutely no sense.
Especially when they've been living together.
Exactly. So.
Yeah.
Good, Lauren.
All right, here's another one. Are there any updates on the status of opening up nonprofit organizations that serve mental and behavioral health facilities? It seems to be a large concern to our area.
Right. I had an inquiry yesterday about somebody that goes to AA meetings, and they were very concerned. And I did get a response back that those are considered groups that can meet in under 10 right now. And so and then also the Zoom opportunities or the like. So I would have to go back and look if they fall within the type that can meet in groups of because from what I looked at, what was sent to me of that this morning about the question I put about the AA, it seemed like there was something that would address exactly what you have. So if I can get an email or somebody shoot me an email, I'll send you what I read this morning from an update from the governor based on that action.
And I would also add that when you have questions like that, it's really helpful to shoot us an email that we can send over to the administration for clarification. It makes it so simple.
Right. And you know what? It helps them rethink some things that they're not thinking through.
Absolutely.
No. More questions, Lauren?
All right. The number of infections seem to be rising in areas like McDonough and Warren County. So how can it be contained while also allowing everyone to go back to work?
So yes, they are. The numbers are certainly rising, and the main reason for that is because we have greater access to testing. We are testing more people. We're getting the results back on a more timely basis. So this was not unexpected at all. And, you know, when I speak about opening things up, we have to understand that I represent all or part of 8 counties. Jill, I think you've got 11. So we have areas that are not significantly impacted. But regardless, I do think that we need to practice the CDC guidelines. We need to be social distancing. We need to be wearing masks when we are in public. And I think that we will, as we continue our testing on a more aggressive basis, I do think that we will begin to see more and more of that.
That's true. I mentioned earlier that using the metrics, and kudos to the public health officials, every county public health department has been working nonstop, and I appreciate that. But all of our suggestions would be in compliance or working closely with what our public health officials and our hospitals are telling us, as they're that they've got the proper medical surge thresholds, and that our testing for positivity is under 20%. Right now in Adams County, it's 2.8%. And we have 76 open beds and only 1 patient hospitalized with COVID at Blessing Hospital. So those are the matrix we'll always be looking at, because public health safety is by far the priority. But there's some things that we can do very safely and start moving forward.
I think we're also seeing a lot of comorbidity factors within a lot of these folks that unfortunately have lost their lives.
Well, I mean, 40% of the deaths, unfortunately, have been in the nursing homes. And that it's horrible, no doubt. But, you know, we definitely want to follow all the compliance and hear from our local health officials about what they think is appropriate. And all of our suggestions have been so far based on that.
All right. What scientists and experts is the governor consulting with that he chose to close the state the way he has?
We've asked him, and we haven't got an answer yet. Now, he has put a lot of people on, you know, I don't know if you're watching his 2:30 daily press conferences, but he, you know, has had several consultants, and I think he's definitely has access in locally in the city of Chicago of some of the highest and finest experts in the country. But we have asked him exactly who he's relying on, and we have yet to get exactly his whole consultant group.
So we have been asking since the very beginning to give us access to your experts that you're relying on and that you're talking to. Keep in mind the individual that was the previous epidemiologist for the state of Illinois pretty much decided in the very beginning, I'm not doing this. And they went to the city of Chicago. So they're working with Mayor Lightfoot in Chicago. And she has actually offered to our caucus to have access to that individual to ask questions, which we are going to take advantage of. But believe it or not, the waters have parted, and coming up here shortly, the House Republican Caucus has access to 2 of the individuals that the governor has been working with, a Sergei Maslov from Russia and a Nigel Goldenfeld from the UK. So we're going to be interested to hear how they're putting their data together.
I might mention an aside, just some of the problems that we've been dealing with is there have been 4,000 inmates in Illinois released since March 20th. And local law enforcement was not notified. These individuals were not tested prior to leaving the prison. And and there was either commutations, they're either on furloughs, and then they'll have to go back into the prison after so many days. Some have had their sentences commuted, and there have been murderers, rapists, sexual predators. We just shake our heads that why would you do that? But these are some of the daily issues that we're dealing with that we find out about, and we just like.
Yeah.
All right, I'm going to read a question I got through email. It kind of goes off of the last one. It says, you have stated that it says, Representative Hammond, you have stated that the boots on the ground know more about what is better for the people in your district than the governor. He states he is listening to the scientists and epidemiologists that make his decisions. Would you share with us the scientific data for our region that your boots on the ground have compiled and how it supports what you believe is best for the people in your district?
So when I made that statement, that I wasn't referring to a computation of data that I had access to, and I have repeated on numerous occasions that, in my opinion, I believe that our local county health departments, working in concert with our hospitals in the area and our healthcare providers and our emergency management people, those are the people that are best in tune with the areas and can best make the decisions for the areas that they are representing. And so that's my point, that the governor, speaking from a podium in Chicago, using someone from Russia and someone from the UK to make decisions for what is appropriate for the people that live in McDonough County, Cass County, Mason County, Schuyler County, that's not appropriate. What is appropriate is that the local people have input into what decisions are being made.
Great, thank you. I'll go back to the chat here. Another question. The economy will not recover in any meaningful way until the virus is defeated. Ultimately, that requires an effective treatment or vaccine. In the interim, it appears the strategy from the governor's office and others is to test, trace, isolate, and treat. If this isn't the best approach to defeat the virus, then what is?
Joe, you want to take it? You want me to take it?
Well, I'm trying to, I'm sorry, Lauren, I guess I missed, I didn't get the actual question. I'm sorry.
And it's also in the chat box if you need to look at it, but it says, do you want me to reread it, or do you want to? I can reread it. It says, the economy will not recover in any meaningful way until the virus is defeated. Ultimately, that requires an effective treatment or vaccine. In the interim, it appears the strategy from the governor's office is to test, trace, isolate, and treat. If this isn't the best approach to defeat the virus, what is?
Oh, I mean, well, certainly we want that vaccine, but as we know, that might be a long thing in coming. A lot of countries are working on it, and American ingenuity is the best. I mean, I think if we've learned one thing from this whole situation is that we've got to get back to relying on products made more within our country. And I'm impressed by hearing about positive things, but as we know, research sometimes can't be rushed in a helpful manner. And so, you know, certainly that's absolutely the best. Now, a lot of people don't like vaccines. A lot of people told me that they don't want to take a vaccine. And again, that's within our rights as Americans. So that's a complicated question, but, you know, certainly as we study this, so much is being learned and so much is unknown, no doubt. And, but still, I think there are things we can do, consulting with the health officials and what they see. I think there are things we can do to reopen this economy in phases and with proper protocol.
So I did bring up to the governor the other day in my phone call with him that, I don't have an argument with testing and tracing. I don't have an argument with that. But I do ask that he and other members of the administration look at our state in a more regional basis. My point to him was, when we have business owners that are ultimately facing bankruptcy, and it could be avoided. I said, we have boutique stores that on a given day, they're lucky to have 4 people in the store at the same time. I said, they have the ability to manage their customers. We don't have a large Macy's. We don't have those types of businesses, but we do have very nice boutiques, men's stores, women's stores, gift stores that you need to give the owners the ability to open their business and do it properly using CDC guidelines. And I believe that their customers would be more than willing to do that. I said, but Governor, you gotta give them a chance, because otherwise they are gonna devastate these local economies. And there are a number of areas where I think that we could do that.
And we can't ignore that Iowa and Missouri are operating far differently, and Indiana. And we're a very long, narrow state. Somebody told me
the big box stores are open and doing business, but
yeah, I mean, when I think I'm happy about the ingenuity. I saw where the lady in Plymouth that has the sewing store is making masks. She's adjusted, but someone told me from Rushville that they, rather than shop in Macomb, they drove to Keokuk because they had more options. And so is that fair to, as Norine says, that local entrepreneur that's invested their heart and soul into starting up a business and now have it shut down when they can operate safely?
Yeah, and there's somebody that asked in here, are there any conversations happening with the governments in Iowa and Missouri to kind of coordinate efforts between the people who are driving back and forth?
The governor has, I haven't heard him mention it lately, but he did say he was consulting with them. And I didn't see Missouri mentioned. If you listen to the Iowa and the Missouri presentation every day, they're way different than what we're hearing from the city of Chicago. It's just their approach is different. And, again, apparently, we want to do things safely, no doubt. And we'll learn from these other states, Georgia or Florida. We'll learn and see what happens there. But likewise, our citizens are going to be shopping and going there rather than here. And so that's our competitive problem all the time, is that we compete with other states. And we have more regulations and restrictions always, it seems, in Illinois.
All right, the next question is, Tazewell, Woodford, and Peoria counties have created their own plan to reopen their economies and are beginning to open businesses. Is it possible for our region to create its own plan rather than following the lengthy 5 phases that the governor has suggested? How is this something that is started or decided?
I really and truly, I have a word of caution here, and I'm not going to judge what Tazewell or Peoria or any other county is doing. And I have publicly stated that I think that we locally should be able to make those decisions. But at the end of the day, we have to be extremely careful because our businesses are at risk. I don't know if there's anybody from the insurance world on this call, but you have to be very careful as a business owner. If you were to decide on your own that you are going to open for business in defiance of the executive order, you may not be covered by insurance if you would unfortunately have a COVID reaction. That's reality.
I think that's true. And if you're licensed, that's a risk. Yep. And many are willing to take that risk, but you know, we just say it cautiously. I know we have put we're still clamoring, as I mentioned earlier, for us to make a case to the governor, look at our metrics and consult with our public health officials and see if we aren't really at phase 3. And just as I said, from what I can determine, I think we are.
All right, thank you. The next question is, what are we doing to protect the food supply?
Well, I represent Beardstown, as Norine does, and we had JBS plant there. They never closed, but they were close because they have had an outbreak. We had Smithfield, Monmouth that did close for a bit. Our food chain's so important to agriculture all the way to the consumer. And I was happy that the president invoked the federal defense action and kept the meatpacking plants open. We don't want those workers to be unsafe. They need safety gear. They need to be distanced. And no matter what, that's going to affect the amount of production. It will slow it down. But it keeps our supply chain going. And certainly protein's a very necessary part of our food chain. And so we want those workers safe, and we want it. So I'm hoping that our food chain will slowly rebuild, but it hadn't been impacted very much. And so is the health and safety of some of those workers in those plants.
And when we look at the meat packing industry, and I hate to say, I mean, it's kind of the nature of the beast. When you are working in those facilities, you are working in very close contact. When I've been through a number of these facilities, these people are literally shoulder to shoulder. So as we fast forward, I think it's important first and foremost to keep in mind that the food is not, the COVID-19 does not affect the food. The COVID-19 affects the workers. And so as we move forward to addressing how we more safely distance in these facilities, then that slows down the production. What we have in cold storage, we have in cold storage, but it slows down the production both in all the proteins, be it beef or pork or chicken. And so that is a significant issue, because if you flip back to the producer, the livestock producer, now you are backing up your animals on your farm. And so let's take a hog farmer, for example, that they have their herd that's going to go for slaughter, and then they clean everything out and they bring in the next load. Well, what they're doing now is they're backing those up because they can't take them to market because there's no place to take them. And so as a result, some of the cattle and hog producers are changing the feed to slow down the weight gain. But unfortunately, they are having to euthanize hundreds of thousands of animals. Across the United States, we expect to euthanize about 750,000 animals. In the state of Illinois, we're probably looking at somewhere upwards of 100,000. So that is significant. I think what we'll see in the future is you may not see the cuts that you would normally be used to seeing. And so I would suggest that you practice trimming out a beef, or you know, you're going to buy a whole chicken. You're not going to buy chicken breast, and you'll be cutting that yourself. But the fact is, this is very serious when it comes to access to our food supply, and it becomes very, very serious for those involved in agriculture and agribusiness. And I really and truly, I'm very frightened for what we'll see. Agriculture has one of the highest rates of suicide in the first place. With situations like this, it's going to be desperate.
Right. Both Norine and I have visited JBS in Smithfield, and I can tell you, prior to this, it's like visiting a laboratory. They're very, very pristine and clean, and people working in white lab coats. But now, I mean, they do work in close proximity, as Norine said. One of the, and now if wearing a mask, of all of you that have worn masks recently, they are very hot. It's just the nature of the covering. And so, you know, it's a real challenge for them to do that. So, you know, kudos to those frontline workers. They, at JBS in Beardstown, they slaughter 20,000 hogs a day, if that gives you a perspective. And these are purchased a year in advance. And so hearing about the euthanization of animals that have nowhere to be processed is very troubling. So, I mean, it's been and that's why I say I was glad that the president enacted that Defense Act that allows the meat packers, or requires them to be open, so that we don't have more impact, but yet these facilities will have to operate safer.
Well, I think to respect your guys' time, I really appreciate the opportunity. We're gonna wrap this up. Lauren, do you want to make a comment real quick about some of the questions that we still have and what we're planning on doing from there?
Sure. There are quite a few questions still left between email and chat. I will go ahead and email those out to Senator Tracy and Representative Hammond and give them an opportunity to answer them when they have a little bit of time. And then I will send those back out to everybody, okay?
Awesome. Thank you.
I really appreciate that.
We appreciate the time.
Yeah, thank you for coming. It means a lot that you make the time for us. There's certainly a lot of people on this call, so it's really nice for you guys to do this. Again, I would recommend what they said. If you got questions about stuff, just email them. They can certainly push it off to the experts in the state. So I would recommend doing that. It's been very helpful for people in my field, that's for sure. So, well, thank you for everybody joining. I'm glad you can be part of this, and I hope you stay safe. Okay.
Thank you. Thank you all very much.
Mm-hmm.